Thank you, Katie, and thanks to the charity for organising this event. It's really wonderful to speak to some of you. Lovely to see all your faces and see some young people here as well. That's really wonderful. You're all welcome. I'm just going to be talking a little bit about, I guess, my journey into psychotherapy and what I've found helpful and what the parents I work with and the children that I work with find helpful, because I think therapy is a really important part of recovering from PANS PANDAS, and actually sometimes, in the middle of it as well, parent support is really important. And I think there's quite a lot of misunderstanding about what therapy is. It can be quite confusing. So I'm going to hope to sort of aim to dispel some of those myths in this session. I chose this picture. I went to an art exhibition over summer of a Japanese artist called 𝘠𝘠𝘬𝘠𝘬 𝘠𝘠𝘪. And I saw this picture, and it's of this little girl, and the house is burning down, and she's kind of looking on. And it really spoke to me as someone with an interest in PANS PANDAS, because it's like the house is on fire. No one really understands why the house is on fire, or how the house got on fire, or how to put the fire out. And it really spoke to me. So just going to talk a little bit about myself. So I've got a long interest in PANS PANDAS, like many people who work either in the charity or with this awful illness. It's because they have lived experience, as I do. I was a journalist, I am a journalist, I still write, but I retrained as a child psychotherapist to work specifically with these children and families. I would say about a third of my clients are PANS PANDAS. I work with children, but I also work with parents. I think parental support's key. I also try to do some advocacy for the illness. I helped set up the all-party parliamentary group. That was a few years ago now. Wonderful to see that, it being on the radar far more than it was back then. And I also write about PANS PANDAS. I've written a couple of pieces recently for the Therapy Today magazine, just trying to spread the word of awareness amongst therapists, because actually therapy is often the front line for spotting PANS PANDAS symptoms at schools and in private practices as well. I'm also in a clinical group of international therapy experts, well, specialists who share knowledge called the Mind Global Alliance, and kind of advocating for better therapeutic understanding of neuroimmune conditions. So you can find out a bit more about me on my website. But let's have a chat about what we're going to talk about, what we hope to cover. So there's lots to talk about. Like Katie said, there will be time for questions. I'm going to move my little bar. I can't see my own slides. So the first thing I'm going to be talking about is looking after yourself, and how you must try to regulate yourself so you can regulate your child. And I know that can be very difficult. So I'll have a look, quite an in-detailed look actually, about how to do that. And then we'll look at what is therapy, how can it help? Because there's lots of different kinds of therapies. And I often think about PANS PANDAS as the symptoms. It's a bit like herding cats, or I don't know, juggling jelly or something. It's really hard to work out what's what, especially when a child is in a flare, and what's the baseline and what's left and what needs support with. So I kind of look at that with you and see if we can make sense of it together. I'll also look at trauma, how to work with trauma. The illness is devastating, and it can be very traumatic, not just for parents, not just for the child, but for siblings as well. And we'll talk about working with a flare, and how to keep safe in a flare as well. And I'm aware there's a lot of heavy content here, a lot of sort of talking about the really difficult things that many of us have had to live with and experience, and might still be experiencing on a day-to-day basis. But I also want to sort of think about hope and hanging on to hope, and how we can manage that in difficult times. So this is the classic, isn't it? You hear this all the time in parenting books. You need to put on your own oxygen mask before you can help anybody else. And it is really true, I think. I think for PANS PANDAS parents, you are often the teacher. You're not just the parent, you're the SEN advocate, you're the health expert, you are the therapist, you're the friend. You're doing an awful lot, and that does take a toll. So there's this idea of containing the container, helping contain the container. So helping the person who's holding everything together get through it. So how do we do that? Well, I think there's a lot to be said for being compassionate towards ourselves and towards our struggles, but also learning how to emotionally regulate. And we'll look at that in a little bit more detail. I don't know if any of you've seen this research about the caregiver. It comes up quite a lot, about the caregiver burden index of families dealing with an active flare of PANS and PANDAS was greater than that of Alzheimer's patients. And if you think about that, that feels like a lot, doesn't it? And how do we manage that? How do we navigate that? How do we support our child when we feel so under stress? We're holding it together. And you can't just push through. You're juggling so much. You need to be well, and you need to keep the show on the road as well. So parents to any child, PANS, PANDAS or not, through childhood, they will help that child emotionally regulate. So we learn a lot from our parents about how to emotionally regulate. And those whose brains may be injured from PANS, PANDAS need extra support, obviously. Some specialists say that in a flare, these children should be treated as if they actually have a brain injury. So they need to feel safe, and they can't feel safe if their family feels like it's falling apart, which is what happens with PANS PANDAS. And I'm not trying to say that every family needs to be perfect for their PANS PANDAS child to thrive, but it's just an awareness of how we can emotionally regulate ourselves to support our child. Because if we think about the child, I mean, the illness, it smashes their world, the suddenness, the isolation, the loss of normality, the peaks and the troughs, the shame of losing your mind, maybe losing control of your body. So it's your job to regulate them. So in an ideal world, I'd love all parents of PANS PANDAS children to have access to an empathic, PANS PANDAS aware, understanding therapist. But, I'm not going to do anyone the disservice of suggesting that's a possibility for everybody, because it's time and it's money. But I think a lot about how I can help parents increase their capacity. So these parents have already got a huge capacity. You're carrying a lot. Even being here for some of you, I know will be a lot. But how can we increase that capacity? So obviously there's all the kind of stuff like around creating a support network, which is really important. But one of the biggest blocks to parenting effectively, I think, is understanding how the past is the present. So if you're struggling, say, with empathy or patience, or you feel a lot of shame about your child's illness and you've been gaslit and you feel guilty about not spotting something, that all might be very real. But actually, if we can think a bit about where that might come from, there's this very great psychoanalytical paper called Ghosts in the Nursery, and it looks at how our parents and how our parents' parents and how our parents' parents' parents shape who we are as parents. And I was talking about this with a brilliant, in the States, they're really far ahead of us, I think, in terms of therapy, and in Australia, actually. I was talking to a very brilliant American therapist called Julie Cox, and she recommended this book. And she recommends this to all the parents she works with, and now I do as well. And I've read it before, called Parenting from the Inside Out. It's by a guy called Dan Siegel. He's a neuroscientist. Really easy to read. Really recommend it, just to kind of understand yourself a bit better, so you can help support your PANS PANDAS child as best you can. But there's also another great sort of therapeutic concept called being a good enough parent. And there is no point striving for perfection. You can just be good enough. You can give what you can. But this is just a way to kind of think about how to increase your capacity. And one of those areas, I think, sometimes with PANS PANDAS parents that I meet, it is.
I'm going to make those trees, so I'm going to try and just change it.
There we go. Is thinking about empathy. So this is a lovely, I hope it's going to work if I play it. It's a lovely Brené Brown short film. I hope the ads don't roll. I've tried to cut it so they don't. But it's looking at empathy and what empathy is and why empathy is so important, and how sometimes empathy can be really hard. I'm going to play this, and then afterwards I'm going to just have a couple of conversations of things that I've spoken with parents about, and kind of thinking about a different way that we could do something. So this is a very short, it's about 3 minutes.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Theresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, I'm down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So I really love noisy. I really like that kind of description of what is empathy. And I think sometimes as parents, we just want our kids to be okay. So sometimes we give a lot of empathy, but sometimes we just want to sort of tidy things up. And I was with a parent recently talking about enmeshment, how to protect their child from their big feelings around the illness. And they've been to the doctors, and the doctor had said, oh, it's just anxiety. And they were like, no, it's not anxiety. You know, there's more to it than this. And they were trying to explain about their PANS PANDAS journey. And the doctor dismissed them, and they came out with their child, who was about 10. And the mum said, oh God, the doctors think we're crazy. We're on our own. Why won't anyone help? And her daughter was upset by that. And we sort of unpicked it together. And actually, of course, that's your response. And you're with your child all the time. And it does feel sometimes like it's you against the world. But we kind of looked at what a different response might be that makes the child feel a bit safer, because they've lost their world. So we need to make them feel as safe as we can. And we thought about, doing something like I can't remember what the animal was at the bottom of the pit, but yeah, it's really difficult. I'm upset too, but we will find someone to help us. We will get there. And I'm here with you every step of the way. That kind of response where you're being empathic and you're not oversharing with your child is something that I think is really difficult when you're in this illness and in the thick of it together. So kind of acknowledging the stress, acknowledging the emotion, but saying, actually, I'm the grown up, I've got this. It might be really difficult, but this is not your worry, this is my worry, because these kids have got a lot to worry about. So this is about grief. It's about understanding the huge turmoil that comes with this illness. And actually, it's okay to grieve that. It's okay to grieve the fact that you've lost trust in the system that was supposed to help you, the grief in people not getting it, not meeting you, the grief in being gaslit by medics and doctors and even therapists, but also the loss, the grief of the family life that you had not being what you expected, and the grief for your other children, and the grief when you see other children thriving. And these are all things that it's important to acknowledge and give space to. And we know as therapists that, and all the research shows that we need to give space to our emotions. There's an expression, I don't know if any of you use it with your kids, called name it to tame it. It's something, if we can name the emotion, okay, you're feeling angry, and then giving it a name kind of reduces its power a little bit. And I think there's something true about that with us as grown-ups too. There's a great, I think she's an American, she's called 𝘗𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝑚𝑒𝑙𝑦 Pearl Kingsley. Don't know if any of you know her. She does some really interesting work on special needs. And she talks about being a special needs parent. And she said, all her pregnancy, she was thinking about what it was going to be like having this baby. And then she had a special needs baby, and it was great, but just great in a different way. And she compares it to going on holiday. And she talks about, you think you're going on holiday to Italy, you've planned for Italy, you've packed for Italy, you love Italy, you can't wait for the food, you get there and you're in Holland. Now, Holland is great, but it's not what you were expecting. And I think with PANS PANDAS parents, there is those flitting between two destinations all the time. You're completely always rattling between Italy, between Holland, between, normality, and then suddenly being in the depths of despair. And I think that's one of the hardest things for parents to regulate themselves through, but also to grieve that normality and that stability. And parents often tell me that they feel guilty about grieving, or that they haven't got the time to grieve or the time to process their own emotions. And that is a real internal conflict, but it is something that you should be compassionate to yourself about and allow yourself that space. And also understanding that grief isn't necessarily linear. It's not like you've got light recovery from PANS PANDAS. You're not like a nice line where you're like, okay, we're all better now. It's up and down, and the layers come at different times in our lives. You might see many years after your child has recovered, you might see a child who looks like your child the day they got the age they were when they got ill, and then that can cause more grief. So it's really important, I think, to give space to that. And allowing yourself a little bit of space in the parenting journey with PANS PANDAS is really good. The American therapist I spoke about earlier, Julie Cox, kind of talks about learning how to surf the waves, not getting caught up and crashing with each wave and trying to fight it, but kind of learning how to ride it, learning how to kind of lose control a little bit, just think, okay, where's this wave taking us? And getting a bit of perspective on that instead of being caught up in the motion of the crashing wave all the time. And that kind of grounding and co-regulation is really, really important, I think, for us as PANS PANDAS parents. I think it's also, I mentioned at the beginning this idea about hope, and I think it's also really important to notice the glimmers. There's an amazing neuroscientist called Stephen Porges. He has done all the fight, flight, freeze stuff. And I think what we know about the nervous system and therapy and PANS PANDAS is it's really important to try to regulate our nervous system. And there's another therapist called 𝘸𝘰𝘬𝘬𝘬𝘬𝘬𝘬, who has done quite a lot of work on how to regulate your nervous system, but also noticing the good bits, the good moments. And sometimes I think with PANS PANDAS, you're in the pit. You're all in the pit. The pit's an awful place and you cannot see a way out of the pit. But actually, it's really important to focus on those glimmers, on those little bits of hope, and remember them and almost like have them in a bank. Okay, well, we're in bed all day today. School hasn't happened. But yesterday, they came downstairs and they had dinner with us. Or yesterday, they managed to call a friend or walk the dog. So it's kind of trying to hold on to those glimmers as well, because the way our brains work, we have these things called neural pathways, and they get well trodden, so your brain knows how to go in a certain way. And sometimes it's just kind of trying to disrupt that and try and see things differently that can help shift things a little bit. Sorry, I'm just have some water. Okay, so where do we start? There's so much going on. Every PANS PANDAS child is different. I often think when I do a normal psychotherapy intake with I say normal, but with a child who doesn't have PANS PANDAS or a chronic health condition, it normally takes me 50 minutes. That's the time of a session. But with PANS PANDAS, I normally have 2 or 3 of those sessions to kind of unravel what's going on and work out the best way forward. Sometimes I'll then go on to have psychotherapy with that child, or sometimes I'll just work with the parents and offer parents support. it's kind of really important to work out what the baseline is. But I think it's often a bit like, herding cats. Is it ADHD symptoms? Is it anxiety? Where are the tics coming from? So it's just really important to try to kind of unpick that. And work out, what's biological, what's normal development or within the boundaries of normal development, what's trauma related. And actually, as a therapist, I really enjoy being a sounding board for parents and kind of working out together a way forward and looking at treatment options and what might happen next. Obviously, I'm not a doctor. I just reflect back with parents, what they're thinking and trying to unravel things a little bit. I wrote an article recently for Therapy Today, and I learned about this concept called epistemic humility. And I went on to speak with a great Australian psychologist called Britta List. I'm saying all these names because these are people who are great on LinkedIn. They're really good to follow for research and insights. And we spoke about this idea of epistemic humility and how many parents and many families' experience of PANS PANDAS is that everything is very siloed. There's no one taking an overview. And when you're in a silo, it's hard to see other opinions. And actually, this idea of epistemic curiosity or humility, this idea of not pretending to know everything, is a really refreshing stance to take and something that I try to integrate into my work. So when you're looking for a therapist, if you're looking for a therapist for your child, I think that's a really important thing to think about. Are they curious? Can they see things from a different perspective? Can they understand that I know my child better than anyone and that nothing is set in stone? So what is therapy? I've written that and I can't even see it. Hang on, let's go back this way. It's kind of making sense of our lives and what's happened to us. There's lots of different modalities, and I think that's where people get confused. Essentially, all the research shows that, and we'll come to OCD in a minute because that is slightly different. It's about the relationship. It's the relationship that somebody has with their therapist, that co-created relationship that's really important. That's where the healing really happens. But good therapy can cause a perspective shift. It can cause you to understand yourself in a more deep way, understand others and your relationship with them in a different way. For families, this idea of growing together, you understand each other more, you develop stronger bonds and greater emotional capacity. So I think there's a lot of benefits from having therapy, not just the child who's suffering from PANS PANDAS, but from the family as well, or thinking therapeutically. So what do we consider when we're thinking about choosing a therapist? Well, there's lots of different modalities, and we'll look at all of those individually in a minute. But you need to look at accreditation, how long people have worked. But the key thing for a PANS PANDAS therapist is that they are PANS PANDAS aware, because these children are more sensitive and have different needs, I think, than many other children. And unfortunately, there's a lack of research about PANS PANDAS and therapy. But what we do know, what I think the PANS PANDAS clinicians group say, and all the advice is that therapy works best during remission or mild symptoms. And we'll look at PANS PANDAS flares in a little bit and what therapy can do in those situations. But the general advice is that, the therapy shouldn't really be happening during a flare. I've written multidisciplinary team there as well. Often the PANS PANDAS children I see have very complex presentations, and it's really helpful to work in a multidisciplinary team. So you'll be working, you can see the notes of either the pediatrician. I work with Dr. 𝘗𝘬𝘵 at the hospital sometimes, but I'll also often get notes from people with neurology or immunology reports attached. And that's really useful because it's really great for everyone to be thinking collectively about a child. And it makes me feel safer to practice that I know that everything is being thought of. So that's something that can be very helpful for therapists. So OCD is a beast. I think it makes kids and people who have it, it's often hidden. It becomes so habitual, becomes part of who you are. And it can make people feel like they're losing their mind because some of the thoughts that OCD typically triggers can be quite shameful. They can be very invasive and they can take over. Again, we know that OCD is successfully treated with CBT, exposure therapy, but we don't know the research about PANS PANDAS. I was speaking to an American therapist called 𝘗𝘰𝘵𝘬𝘵 about this recently, about how there's little information about how PANS PANDAS affects our neurochemistry and what that means for the processing of emotions, and whether, you know, exposure therapy is the standard treatment for OCD, but sometimes with kids who've got PANS PANDAS, it doesn't stick, and we're not quite sure why. Is it because there's still something immune driving the OCD, or is it something about how the brain is processing at that time that doesn't respond to cognitive behavioral therapy? This is a great book. I put this at the end. About OCD. It's called Tools to Help You Fight Back. It's actually for clinicians, but it's the book. It's only been out for a couple of years, and it's such a great resource. It's from the 𝘗𝘬𝘵𝘬𝘬, which is where the Michael Rutter Centre is, where the National OCD Centre is. It's for clinicians, but it's got some really great advice there for parents and therapists around psychoeducation. But it also kind of demystifies OCD treatment a little bit as well, because I think when you hear about how you're going to treat OCD, and part of that is removing the compulsions and trying to let the anxiety kind of die down naturally. And that sounds quite frightening, but this book kind of demystifies it and shows you how actually you tackle the very lowest obsessive thoughts and compulsions first before working your way up. So it feels like quite a supportive way to do it. I've been trained in something called SPACE, which is, they're doing a lot of that in America. There were quite a few CAMS people on the training as well. It's essentially treating OCD in a similar way to CBT and exposure therapy, but you only work with the parents. So this would be if the child is very dysregulated, if they're anti-therapy, and it's shown clinically to be as effective as CBT and exposure therapy. That's come out of Yale University, I think, and I think we're going to be seeing quite a lot more of that. Okay, I love that little picture. Can't stop thinking about it. So dialectical behavioral therapy is something I've recently discovered. I think it's brilliant. I'm not trained in it. I wish I was. I think it's really great for PANS PANDAS children. It copes with extreme emotions and emotional dysregulation. I think it keeps children and teenagers it gives them the tools for being safe. I was with a psychiatrist who was talking about it recently, and he said it's not just like teaching a child certain things, like it's not about mindfulness or it's not about naming your emotions. He said it's not just one note, but it's a symphony. You're giving them a symphony of tools to choose from to help in those moments when they feel that they're losing control, and those moments where they might feel quite unsafe. So I think it's a really useful for children who are at the end of the, you know, perhaps more the really bad ADHD, emotional overwhelm, PDA kind of presentation with these big feelings. So how it works is it's about emotional regulation. It helps you name and track big feelings, and it uses strategies to reduce the intensity of those feelings. So it offers quite a good framework and a structure for when their neurobiology might be out of control. It's got really great tools for crisis moments. It's about mindfulness, encouraging acceptance of distress. There's some great DBT therapy programs I know that come out of London. And part of that sometimes is the therapist and the child having occasional conversations in, you know, arranged. If I'm feeling really overwhelmed, they'll have a check-in outside of therapy. How are you doing? How are you going to get through this? How can you resource yourself? So I think it's a really valuable tool for therapists working with PANS PANDAS children. Again, it's really critical that the therapist is PANS PANDAS aware, because you don't want to set a child up for therapy, whether it's OCD, exposure therapy, or DBT, and them not be able to do it because their brain is inflamed or their brain is, you know, not in the right place to do it, because these kids feel a lot of shame about lots of different things, and you don't want therapy to become a place of shame. You want it to become a place of being understood, being heard, feeling safe in a world that often isn't safe feeling for these children. So I'm an integrative psychotherapist. That means I pick from lots of different theories according to the child that I'm working with. So it's a talking therapy. I tend to work with families when they're coming in and then when they're coming out of a PANS illness. In the middle of that, if there's a flare, I will just work with the parents doing psychoeducation. I'm arts based. There's lots of research on how the arts help children, in particular teens tend to not want to go near the arts, but younger children tend to enjoy it. But also it helps them process trauma that might be even pre-verbal if they got PANS PANDAS when they were younger, or maybe they can't find the words to express how they feel. So that can be really, really useful. I think that the trial of waiting for diagnosis and not really understanding what's happening really takes its toll on children. This kind of idea that the world isn't safe anymore and the people that they thought were going to look after them haven't been able to. I'm not talking about their parents, talking about doctors and teachers and no one getting it. So talking therapy can really help sort of adjust to living with an illness or fear of relapse, but also looking at the loss of trust in the system and their own bodies and mind. And it can support reintegration into school and life. So I always work systemically. I work with parents and I work with the school to help that child, find a space and find something for them at that school. And there's this lovely expression about the window of tolerance. I don't know if you know it. It's really useful. It's looking at, we all have a window of tolerance, and some people have a big window of tolerance and some people have a small window of tolerance. It kind of goes back to what I was talking about at the beginning about increasing capacity. And I think it's a really useful way to think about our PANS PANDAS children is what is their window of tolerance right now? Can they manage it to the shops? Can they manage it to school? How can I expand that window of tolerance? And that might come through working on nervous system regulation. It might come through therapy. It might come through a gentle walk or whatever. But one of the things that I really do with kids that I work with is think about who am I? So I've got a variety of different children here. But I think one of the things with PANS PANDAS and any chronic, long-lasting, debilitating, misunderstood childhood illness is that it's very easy for parents as well, actually, but for children to lose their sense of self. They've lost a huge amount of developmental time. They've lost school. They've lost social connections. Add that COVID into the mix because of lots of the kids coming through now also were impacted by COVID. And it's really, really very difficult for them. And it's really important for the parents to hold on to the idea of who their child was, especially if there's lots of meltdowns and, emotional dysregulation. It can be hard to remember who your child was, but actually to remember, okay, they used to love Lego. Do you remember when they used to snuggle in bed with me? And just kind of remembering that, but with the child in therapy, really kind of leaning in to their likes and needs. And sometimes I've seen kids who've been out of school for a long time, and I will be their only point of contact outside of their family for an hour a week. And in that hour, they can feel heard, they can feel safe, there's no shame. Someone is there just for them, meeting them where they are, encouraging them. And that can be a really wonderful part of PANS PANDAS therapy, I think. So where am I going? Okay, so thinking again about other modalities of therapy. Well, family therapy, again, expensive, but it can be very useful in recovery. Families, as we know, OCD can split families, PANS PANDAS can split families. Might be that one parent thinks this, the other parent thinks that, and then the siblings are split and it becomes very complicated. Family therapy, you can get that through CAMS sometimes, can be very, very useful for recovery. There are other things I haven't spoken about, things like tick treatment, which is CBT. Again, that needs to be done by someone who's PANS PANDAS aware, what's biological, what's behavioral, all that kind of stuff is really important. And then obviously eating disorders. You know, something like an eating disorder, I don't think a therapist would work on their own with that. You would need a multidisciplinary team. You would definitely need the GP. There's quite a few good eating disorder therapists around who will specifically work on that. But again, it's all about where you are in the phase of the illness. So there's lots of different things you can do. It's just a question of, you know, finding the right people and working out what's what and what's necessary at what time and what stages. Okay, so this is that famous Edward Munch about I think it's called The Scream. So thinking about, let's move this. Okay, so we're thinking about trauma. There's research that shows it's common for family members of PANS pandas to develop PTSD from PANS flares, and the need to fight for medical care and the need to be heard and the need to be listened to. The trauma is something that I see a lot of, and you really have to work very slowly with that with PANS pandas children. You really have to make sure you understand what their baseline is, whether they're flaring, because we don't know how processing emotions is when a child's brain is in a state of distress. You really have to listen to the child about how fast they want to go. I work in a way where the child leads, I follow, and then they lead. And that's just me, you know, really trying to sort of track the child and where they are and not bring things in, because if therapy is going to be a safe space for them when the world hasn't been particularly safe because of their illness, because of school, it's really important that in that space they don't feel under pressure, they don't feel like they have to be fixed almost. You know, therapy is a place to come and be heard and understood. There's lots of other trauma therapies. There's something called EMDR. I've heard of PANS pandas families who've had that and it's been successful. I love something called brain spotting, really big in the States with some PANS pandas therapists, but there isn't really the evidence base. It's not as much as used as much here, but I've had it and I thought it was great. There's also body work. There's a great book by Bessel van der Kolk called The Body Keeps the Score. It's a really good way of understanding how our bodies react to stress and trauma, and it'd be quite useful for parents to think about their own journeys, I think. Conscious that I'm running out of time. So moving on to flares. So what we know about flares is that in severe flares, therapy does not work. The client is not stable. Therapy is not, it should not happen. That is a time when parents need support and psychoeducation. Clinical experience suggests psychotherapy in severe PANS should mirror intervention during acute brain injury or in acute psychosis. So that's just kind of some idea of the level of intervention that could be helpful. So in flares, parents are the focus of treatment. And obviously, we all know you reduce stress, you reduce demands, you let the child lead. You have to trust the child, you know, to tell you what they're capable of. Safety planning is always something I do. Always hesitate to talk about it because people find it difficult, but you have to talk about it. So if your child is very dysregulated, you need a safety plan. That might be emergency medication from your doctor. That might be simply organizing your house in a different way. It might be awareness. It might be having a code with your child and opening conversations with the child around, you know, do you feel safe? You know, are you feeling safe? Because obviously we want to keep our children safe and we don't want risky behavior or self-harm or anything. So it's always good to think about what your rescue plan and what your emergency plan might be and create a sort of support network around yourself for those moments when you might have to dash to the doctors and if you've got other siblings. A really good resource for this is this idea of keeping track. So you can just do a document. I do it for some of the kids I work with. I do a document. So at the top, I have green behaviors, going to school, eating well, phoning a friend, sleeping. Then I have amber behaviors when they're not quite right. And then I have the red behaviors, can't sleep, can't eat, very upset. And it's just a very good way, because I think sometimes with PANS pandas is you lose sense of reality a little bit. You're not quite sure what's normal and what's not. So actually, if you've got it written down, you can kind of see, okay, we've escalated, we've gone to amber now. How can I nudge my child back up to green? It might be that you can't, it might be that you need to see the immunologist or the psychiatrist, but it's always kind of worth thinking about just kind of tracking and keeping awareness of where your child is. So it feels like it's been like a lot of like, oh my goodness, things are hard. There's some great research that's not out yet by, and I'm going to forget, where is it? Yes, it is by the woman who wrote the great book about PANS in school. Tina would know this. She's called 𝘗𝘬𝘬𝘪𝘯𝘨. She's great. She's just done this big qualitative study on insights about PANS from adult survivors. And it shows that actually for these families, there's a very strong parent-child attachment. I mean, these parents have helped these kids get through, and that is recognized. And it's this idea of this absolute champion role because the parent believed the child, they advocated for them, and they provided unwavering support. And their advocacy and how they navigated the system has made a huge difference to that child's life, a lifelong impact, according to this study. And children have managed to internalize their parents' love and the advocacy. And the report says it's going to shape their future resilience and capacity to care for others. So that kind of feels, I hate that expression of what doesn't kill you makes you stronger. I think it's nonsense. But I think what this shows is that, you know, this adversity that many people here have experienced has meant they've grown in different ways. They've grown in capacity. And this study shows that actually for many of us, our relationships with our children might be even stronger at the end of it. And that's all. Thank you very much for listening.
Amazing. Thank you so much, Lucy. That was lovely. And a huge thank you to you and to everybody for bearing with us through and supporting us with our technical difficulties. So we have some questions coming up in the chat. I don't know whether we'll get through them all because I'm mindful of time, but we can make a start and,
yes.
And share the rest with everybody afterwards. And just to let you all know that Lucy can't comment on any sort of questions specific to a child, but can talk more broadly around the theme. So the first one is asking, where exactly can we find PANS and PANDAS psychological support, and is it possible to do that online?
Well, it depends. I mean, I think there's very few, as far as I'm aware, specialist PANS PANDAS therapists in the country. I could be wrong. I think there's someone who, I work at the hospital sometimes, and there's another therapist at the hospital as well. I have heard of a few adult therapists who have had children who've had PANS PANDAS who are looking to work with that population, but that's kind of 18 plus. So there's I think that obviously things are shifting. I'm hearing about more CAMs that are PANS aware, but I don't know whether they are there yet. Ideally, you know, a good therapist should have a broad mind and be happy to research, you know, into an illness and support you in that way. And there are quite a few resources, I think, now around for therapists to educate them. But there isn't like a PANS PANDAS therapy hub. As for online, I tend to only work with 14 plus online, and that is because with younger children, and I have worked with a younger PANS child before, but you can't tell when they're flaring, and that you lose so much with children who might not be as across their feelings as a teenager, or able to express their feelings as a teenager can. So it would very much depend on the child, really.
Excellent. Thank you, Lucy. And I think that sort of responds as well to the question about sort of PANDAS aware psychologists within CAMS. So somebody else has said, my child is about to start EMDR with CAMS. If CBT hasn't been helpful for a child, would EMDR be helpful?
I don't know what the presenting issues are. I mean, MDR is normally for trauma. CBT would normally be, I think, for anxiety or OCD. I think EMDR can be very, very effective. I don't know if there's any, don't think there's any research for it, particularly with PANS PANDAS, but it normally done well is quite a gentle way of unlocking and processing trauma. Some people find it amazing. I don't know what the success rates are, but I think they work in quite different ways. CBT is cognitive behavioral therapy, so it's kind of changing how you behave towards your thoughts, as I understand it. EMDR is something I think that was developed after the Second World War to help soldiers get over PTSD from being in the trenches, I think, or maybe it was the First World War. But it's like a tracking thing where you kind of, your eyeballs, you move your eyes and it helps process trauma. I think EMDR can be, with the CBT therapy, I think you need kind of quite a few sessions. I think EMDR works a bit more quickly, but I'm not trained in it. So this is just like a layperson really observing it.
Thank you. And then I have another one question here asking what age you would recommend therapy from. So when would a child be ready to engage with therapy?
Again, it would all depend on the child. I mean, I've worked with children from 4, and a lot of therapy with younger children is play. And it might not look like therapy, but it's certainly very therapeutic. And actually what you see with these children who are younger children who are playing is they are playing out the same scenario often again and again and again. And it's because they're processing what's happened to them. So I've had kids who've, like in the sand tray, I've got a big sand tray where you can kind of track out your life and just play. But some kids will do battle after week after week after week after week, and you'll have 20 weeks of battles. And I'm saying to my supervisor, oh, this kid is just doing this battle every week, 20 weeks we've had this battle. And she was like, well, it's like you going into your therapist and talking about the same thing for 20 weeks. He's just processing it, he's working it out. And actually with this child, and that's a very common theme with children fighting in the sandbox, it actually petered out, and then we moved on to something else, and it was like he'd worked it through. So even with very young children, play tells a therapist an awful lot about their internal world, but there's lots of research to prove that it really can help children relationally, but also process trauma and things that have happened to them.